the story of Bharat, which is accessible healthcare for all. Hello everyone, I'm Dr. Ackshay Ambekar. I'm a medical professional and I'm actually practicing in Mumbai right now. So I am here at NXT Fellowship, Conclave, to talk about something which I think every one of us is expecting in a way, is the advancement of health tech when it comes to India, health tech and healthcare. So the digital health mission is one which I think is spearheading the idea of the story of Bharat, which is accessible healthcare for all. So accessibility and affordability has been major barriers when it comes to the entire healthcare system, ecosystem of the world. And I would like to talk about, let's take a story for example. Okay, let's take two patients, one traveling from a tier 3 village to a tier 2 or a tier 1 space, and another a foreign national who's come to Bharat, for example, to get affordable healthcare. Now the question here is, can Bharat cater to both of these the situations with this equal amount of care? I mean, let's go, drum roll. And guess what? I mean, everyone knows the answer, it's yes. But so, because I'm short on time, I'd like to explain to you how health tech is going to apply in majorly 4 fields. So I'd like to talk about AI when it comes to research, AI when it comes to diagnostics, AI when it comes to treatment, and AI when it comes to accessibility. So let's first talk about health tech and AI when it comes to research. So I'd like to put 2 words out there, health informatics. So health informatics is basically the collection of electronic medical records of various patients, and right now with the upcoming government and the upcoming speeches that I have heard myself, is that they're planning to surveil this data and make it private so that they can supply this data to the researchers where it's required. So guess what? Now all the research are gonna be surveilled. That means it's going to be proofed, it's going to be secure, it's going to be private. There won't be selling of data, because of which our data will be our data, Indian data. So all the research that usually happens is usually data which is outside the researches is done outside India. But with the advent of AI, especially in that aspect of research and health informatics, we'll have Indian data and we'll have Indian results so that we can cater to Indian society. Second, I would like to talk about is health tech and AI when it comes to diagnostics. We have already reached a point there where we talk about AI in stethoscopes, AI in chest x-rays for the checking for tuberculosis, and I'm very sure that there's going to be a moment where AI will be used to read for oncogenes in our system, and thereby spearheading and getting like truly fast when it comes to knowing which sort of cancer can exist or might exist, the presence of carcinogens in our system. We can also use AI for managing or knowing what all climate change is happening, which can cater in the next 5 years to the release of certain carcinogens out there. Third, I would like to talk about is AI in treatment. So AI in treatment we talk about, I would like to specify something called as precision medicine. Precision medicine is basically personalized medicine. So what the thought is right now is that we use artificial intelligence to reduce the time for genome sequencing and also for behavioral predictability, which will help to cater the treatment options to a specified individual. I mean, who doesn't want personalized medication? Like precision medicine is the next big thing out there. And with pharmaceutical companies going hand in hand with this tech, I think that Bharat is going to be able to pioneer this by 2047, which is the idea of Viksit Bharat. Last I would like to mention is the idea of AI in affordability and accessibility. So because in Bharat, the healthcare and health tech and the entire healthcare industry is really accessible to the people. We have got blood tests which are happening at home. Nurses are going home, there are medical professionals going door to door to get the tests done. With this, we see that actually healthcare is accessible in India, and compared to something outside India, it's really, really affordable. So the next idea is the talk of medical tourism. We actually thinking of have complete packages so that people can come to India, take affordable care, use accessibility, and go back as well and fit individuals. We need healthy individuals, and I think that India and Bharat, Viksit Bharat, is the one which is going to pioneer in health tech and healthcare in the world. It's going to lead its hand. And the last example and last just thought that I would like to give you is I don't know if anyone has heard about Sushrut or Sushrut Samhita. Sushrut Samhita was the first surgeon when it came to our history in surgery. So healthcare, health ideas and I mean, health tech was something which existed in India long before anyone else in the world approved of anything. And from doing the first surgery of the world to developing something as good as thermolytics, which is screening of breast cancer using thermal radiation. I mean, that's just amazing. And I think that India is going to do amazing.